are listening to the Pharmacist Answers podcast. I'm Cynthia, the pharmacist, and today you'll get your questions answered and your curiosity cured. Last week, I had started talking about different symptoms and side effects that people may experience from medications that they'll then go and tell their doctor or their pharmacist, be like, I can't take that, I'm allergic to it. And really the truth is it wasn't an allergy, it was just like a side effect. Something that you probably couldn't tolerate because you didn't want to keep taking it. But most of the side effects or symptoms that I've come up with are things that people will experience if they're having anaphylaxis. And during anaphylaxis, it's just much more severe. People will complain of headaches. Headaches are one of those ambiguous side effects, kind of like nausea is, that I talked about on the first day. Like anything in the wrong amount can make you nauseous. Just about anything that you can think of will give you a headache. So a headache is something that, like, just about anything can give you a headache. So just because it gives you a headache doesn't necessarily mean that you're allergic to it or that you shouldn't take it because it gave you a headache. And usually headaches caused by medication, short-lived, meaning that you can take something when you get the headache, and then if you can make it through the first couple of days as your body's adjusting to taking it, then you're not going to experience the headache anymore. A couple of medications that are classified that way are hormones. Hormones, whether it's a hormone replacement or birth control, can cause headache. And so the same way with the way that hormones can cause nausea and that hormones can cause hot flashes and flushing, sometimes the best way to deal with that is to take it at night, go to sleep. You sleep through the misery that it may cause you because your body's adjusting to taking it. Then after a week or two, you don't really experience those anymore. But if you're asleep, then you usually don't notice that you feel nauseous, especially if it's mild. You usually don't notice that you have a headache if it's mild. You sleep those things off and it's gone when you wake up. But while you're awake, you're getting the benefits of the medication that you're taking. Blood pressure medications can do the same thing. And I had a long conversation with a guy about blood pressure medication, about his blood pressure medication the other day, because it did cause him headaches. It caused him some headaches. It caused him dizziness. And the tricky thing about blood pressure, and I'll probably need to do a longer topic on this, is that if you have high blood pressure, your body starts to cope with the fact that you have high blood pressure, and that high blood pressure kind of becomes your body's new normal. So then when you take medication to lower your blood pressure, because we know even though your body feels normal with a high blood pressure, that high blood pressure can potentially kill you. So we want it to be lower, but then when we lower that blood pressure that your body became adjusted to, you start feeling symptoms of low blood pressure, even though your blood pressure numbers are kind of like in that normal range. So then that can lead to lightheadedness, that can lead to dizziness, because those are symptoms of having low blood pressure. And so blood pressure medications, people will do the same thing. Blood pressure medicines also tend to make people drowsy because they are lowering the blood pressure. And some blood pressure medications also lower heart rate, so that can also lead you to feel tired. So they'll take them at bedtime, go to sleep, sleep through all that, then wake up the next day, and then they reap the benefits of having lower blood pressure and knowing that their body is in a healthy range, but they're not having to deal with the side effects of the medication due to the side effects happening during your work hours and when you're trying to be awake and be productive. Sometimes it can be intolerant, but sometimes if you can find a way to make it more tolerable for you, or again, get over that hump of these new side effects being temporary when you start a new medication or have a medication adjusted, then the backside of that is you don't suffer side effects, but you reap the benefits of the medication that the body is trying to help you with. So something else that people talk about, cranky mom of two. Do I know you? Let's see what your name is. Becky. I'm at chemo right now. Oh, Becky. That's like a whole new realm of medications that cause side effects that people have all kinds of, and I'm an RN when I'm not sick. Well, you're super RN Becky. Oh, I can show you photos. Oh man, that's the reason that I did not become a nurse. Because I don't need to see people's junk. People still do that to me as a pharmacist. But, I'll learn about it. I'll see diagrams and, but I don't need people coming in and being like, they still do. They'll like try to take their clothes off and show me stuff. And people make you mad when they lie about their allergies. It's true. People will do two different things. They will say that they're not allergic to anything, so then you start to treat them and they have a really bad reaction. And then that's a whole new medical emergency in itself. Red man's reaction is pretty nasty. And it's not a pretty picture if it ends up being really severe. At least in the pharmacy, when they come to the pharmacy and I have to get a list of people's allergies, they will give me this whole list of medications that they're allergic to that aren't usually high offenders. Yes, EpiPens are a lifesaver for a lot of people in all kinds of situations, whether it's medication allergies or environmental allergies or stinging insects. But people will try to tell me that they're allergic to certain medications when really and truly it wasn't an allergy. They just experienced a side effect that caused them to stop taking that medication. And some medications, you can get around those side effects to make it more tolerable for you, but other times you can't. And so that's kind of the difference. Yeah, side effects are not allergies. And on a different day, I had talked about the skin itching that can be caused by narcotic medications. And that is a typical side effect, generally not an allergy, even though it can be really intolerable. And sometimes people will choose not to take things that make them itch. But people will go to their doctors and give them this long list of like low grade pain medications that they're allergic to. So then they can get like the higher grade ones. But the fact is if you're truly allergic to something that it has codeine in it or codeine related, then most likely you're allergic to all of them. So it's not like you're allergic to codeine and you're allergic to hydrocodone and whatever, but you can take OxyContin. Like, that's dumb. Anybody who has a smart medical brain will know that that's dumb. Things that stop your breathing, you don't need to take again unless you are under like strict supervision of like medical professionals. Things that close up your airways, things that close up your swallowing, things that like swell you up and cause your blood vessels to dilate and like you're gonna leak all of your blood out of your blood vessels. Those are all symptoms of anaphylaxis or something that's anaphylactic like. And things that cause that to happen to you, you don't need to continue to take. But if it's something that causes mild nausea, something that causes a mild headache, and you're like, that makes me kind of miserable, but if there's a way that you can get around it, again, to get over the hump of the side effect, but reap the benefit of the medication, then we know that the benefit of the medication is going to extend your life and make you feel better in the long run. Another set of medication that leads to like this nervous feeling or irritability and jitteriness that people will really complain about, Zofran is your best friend. Oh yeah, if you're on chemo, I bet Zofran is your best friend. The irritability, things that increase your heart rate, so stimulants. People who have to be on amphetamines for attention disorders. Cold medication, like pseudoephedrine. What do I think of Focalin? Focalin, the whole group of amphetamine medications, when there is a true chemical deficiency in your brain, because this sounds dumb. Here's the thing that I learned about ADD and ADHD and all this stuff. It sounds dumb to give a stimulant to someone who is already hyper. You just say that statement, it sounds stupid. But here's the thing about attention deficit disorders, is that the area of the brain that controls your attention span and your ability to focus long term on something very clearly is hypoactive, which means that it's not very active. So if that area is not very active, the other areas of the brain, so the areas that control the things that you hear, the area of the brain that controls the things that you see, those things that when they get stimulated by teeny tiny things, if your focus area of your brain is not functioning right, then any little stimulant is going to distract you, and then your brain's going to be like zipping like squirrel every time. So when they learned that, then they learned that the amphetamines can go into that area of the brain and stimulate it to a normal level of activity. And then when the focus area of your brain is functioning properly, then tiny little distractions your brain can block out. So again, when you say to like a normal person, we know your kid's hyper, but and you find out that amphetamines and all of the medications that fall into that category, like Adderall and Focalin and Ritalin and Vyvanse, when you find out that they're stimulants, you're like, this is counterintuitive and it sounds dumb. But when you find out how the area of the brain works and how that medicine goes into that area of the brain to help them, then it makes complete sense. Because if we can get the attention focus area of the brain, you looked at like the scan of all of the electrical activity of the brain, if you can get that area to be really, really lit up, then anything else that may spark the other areas of the brain, like, again, your visual cortex, your auditory areas, any of those little things that would be a distraction to a kid who has ADD or ADHD, those little sparks on the lit up thing aren't going to detract from the light of the focus part, because they're able to pay attention. Professionals who have a very high stress, high focus kind of job, so like CEOs, politicians, people who have kind of those jobs where like their whole entire day is spent like making crucial decisions, their doctors will give them a short-acting stimulants for like ADHD medications, so that area of their brain can get a lot of the body's attention and energy, so then they can do their job and be focused for their job and not get worn down. Stimulant medications, though they work and they benefit a lot of people who really need them, one of the side effects is that it can lead to jitteriness or irritability. So a lot of ADD medications will have a side effect, especially in kids, that they become really moody, because again, it's stimulating all this stuff in the brain and they just may not be able to cope with it. Cold medicines can lead to irritability and nervousness. Pseudoephedrine is a big culprit of causing increased heart rate and making people jittery. So a lot of times people are like, oh, I just want something that I can take one time a day, and they come and get 24-hour Sudafed, and then they complain because they can't sleep at night. Yep, country roads, big trucks, that's the noise you hear in the background. So sometimes it's better to take a 12-hour version of the Sudafed, take it in the morning, then it wears off in time, and then you can still sleep at night, because having a medication that keeps you awake at night is pretty miserable. And then one of the last things is some medications can lead to joint and bone pain, and that can be pretty intolerable. Again, sometimes these side effects of medications that aren't true allergies are just temporary, and if you can get through the hump, then the benefit on the other side is much greater. So cholesterol medications can actually cause joint and bone pain. For some cholesterol medications, the side effect, if it sticks around for a long time or it's really excruciating, then that's a side effect that you don't want to try to push through. But there is one group of medications that can cause joint pain that you do not want to push through. And that is a certain type of antibiotics. They're called quinolones. So Cipro, Levaquin are two of the most common ones. They have a rare but serious and kind of permanent side effect of tendon rupture. If you have tendon or muscle pain while taking those, then you should immediately stop, and that's not one that we want people to just like take something and be like, oh, I'll just treat this and keep taking it, because tendon rupture is usually permanent. If a tendon ruptures, then usually there's not much that can be done past like some major surgery to rebuild that, to connect those tendons back. And if you don't remember, tendons are the connective tissue that anchor the muscle to the bone. Here's my arm, and you've got this bicep muscle that bulges when you flex your arm, and there's tendons that connect it down here to the bottom of the bone by your elbow, and then there's tendons that connect it up here to your shoulder. So it's like two anchor points, so then when you flex that muscle, then it has a place to hold on to on both sides to contract and give you power. If one of those ruptures or becomes disconnected, it only anchors at one place, and you won't be able to flex that muscle and use it to do work. So muscle pain, joint pain, can be typical. It's also typical of medications that help your bones, like osteoporosis medications. If you start taking something for osteoporosis and it's gonna like start help rebuilding your bones, if it's doing all of this focus on your bones and doing all this work with the chemicals and the mechanisms that build and restructure your bones, then you're probably gonna feel that. It's usually temporary, and people can get through it and then reap the benefit of not having osteoporosis on the other side while you're taking it. So anyway, good luck to Becky. Bye. Thanks for listening to the Pharmacist Answers podcast. The pharmacy is now closed. You can post your questions and comments on our Facebook page. That's facebook.com/pharmanswerspod. Or you can email the show at pharmacistanswershere@gmail.com. You can tweet me or message me on Twitter at @SinHendrix. You can find the show notes at pharmacistanswershere.wordpress.com. Pharmacist Answers broadcasts live on Monday, Wednesday, and Thursday at 9:02 a.m. Eastern Time on the Periscope app. You can follow me at SinHendrix or view in your web browser at periscope.tv/SinHendrix. See you next time on the Pharmacist Answers podcast.